collaboration with the Cyprus Mail. This is the Cyprus News Digest with Rosie Haralambous.
Lockdown restrictions are being eased, but the experts warn that we must still be careful.
Keeping the distances is what is extremely important, at least these first 2 weeks.
And we discuss the impact of isolation on the elderly.
When somebody is alone in the house, first is the obvious psychological problems. If they hear the news all the time, this creates a lot of anxiety and stress.
The lockdown restrictions in Cyprus are coming to an end. The President addressed the nation on Wednesday and explained how things would change. People may go out 3 times a day now rather than just once. Public sector workers will be returning to work. However, along with all the other relaxations, there is a note of caution, particularly for vulnerable people. Well, earlier in the week, I spoke to one of the members of the Health Committee that is advising the government on the COVID-19 pandemic. Peter Karagiannis is a professor at the Nicosia Medical School, and when I spoke to him on Tuesday, I asked him first to bring us up to speed on the actual number of cases and deaths from the pandemic here in Cyprus.
We are at the end of the road, I would say, because for the last 10 days or so, the number of cases has been very low, below 10 in fact, and I suspect in the next few days we may have a couple of days with 0 cases. So we've done very well. I think the current count is 825 cases, but of course this is the known cases. There may be as many as twice this number out there who've never been ill, but nevertheless they've been exposed to the virus and probably formed antibodies. As far as the number of deaths is concerned, I think now there are 20 deaths, 15 of which are attributable to the SARS-CoV-2. So all in all, the picture has been quite good as far as Cyprus is concerned, indicating that the austere measures which were imposed by the government early on has stopped the spread of the virus in the community, and we've been in a position within 6-7 weeks to control the epidemic in Cyprus.
Right. Now we come to the fact that I think the President is meeting with various committees today to make decisions in Cabinet on Wednesday as to whether or not some of these measures can be lifted. And we're hearing that there's a chance it'll be done in stages. Can you enlighten us on that?
Yes, the meeting is at 10 o'clock. This will be my 3rd visit to the Presidential Palace. In previous times we talked about various things to do with the epidemic and how to control it. Today we will be finalizing the measures, at least the first round of relaxations, that will be started probably on the 4th of May. So to start with, businesses which can kick off are those which are in open spaces, in other words, building sites, yards of various sorts that have to do with the building domain, and small businesses where the workers can work safely with adequate space one from the other, and businesses which accept small number of clients daily or by appointment. So we're going to sort of tread carefully these first relaxation measures and the period that follows, the 2 weeks of stabilization, monitoring the situation with frequent sampling from both workers and customers, and hopefully we will not have any problems by way of transmission.
Now then, we heard that possibly shoe shops and clothes shops might reopen. I'm just wondering, if you go into a clothes shop, you very often try on the clothes before you buy them. Now, what's the situation with that?
Well, the idea is that if the customers go in and use the antiseptic gel on their hands, they will be wearing their masks, and therefore, if they try the clothes on, they should not contaminate the clothing with any of their nasal secretions. So I don't see a problem there, provided this procedure is followed very faithfully.
So you're going to make people wear masks when they go into shops, that's for sure?
Yes. Both the workers and the customers will need to wear masks.
We've also heard that it's possible, like in other countries, that the elderly will be asked to continue their self-isolation a little longer. And it's very concerning because they're one of the groups that are probably most impacted, certainly in mental health terms, because they possibly don't have access to the technology that others are using to keep in touch with friends and family and so on. So what's the position with regard to the older generation?
It's true that the recommendation will be to remain isolated, but not completely isolated. In other words, I don't see any problem them using their verandas and their loved ones coming, say, to the gate and talking to them, or sitting outside some distance away from them, as long as there is no direct contact. And they keep this 2-meter safe distance. So in that respect, I don't see either a problem then sort of wearing their mask and taking a walk around the block, provided once again they don't sort of come face to face with anybody and start chatting up. Keeping the distances is what is extremely important, at least these first 2 weeks. In the second wave, when I think all the restrictions about movement will be lifted, then of course I don't see why they shouldn't take their car and go for a drive in an open space, or to the beach somewhere and stay within their car, of course opening the windows. It's summertime soon, so people will be sitting out in open spaces, so I don't see why they shouldn't do it, provided they take precautions and frequent either washing of the hands with soap and water or the antiseptic gels.
Very quickly, because I know you've got to go, Peter, you mentioned the beach, and that's something that a lot of people have been querying. Why solo swimmers were called out of the water by the police? Surely that is very healthy exercise, and if you're doing it on your own, what was the problem?
Yes, I've heard about that, and it seems that some police forces, they allowed the swimmers to continue, whilst others, they sort of imposed the fine. I think some of these cases are going to be looked at by this special committee that deals with complaints. I personally feel that those who had particularly medical certificates that exercise was good for their health, they should have been spared this trauma of the fine. Hopefully the others will have their money returned.
Okay.
Anyway, tomorrow we'll probably hear that lone swimming will be allowed. The beaches will not. I mean, the plage will not open for people to sit on the beach yet, but to go in and out of the sea will be fine for a swim until the ban is lifted in 15 days' time.
But no days out to the beach and sitting down in the sunshine?
Let's wait and see what we decide today and tomorrow.
Virologist Professor Peter Karayannis, who sits on the Health Ministry's COVID-19 Advisory Committee. While there's relief from many that things will now be starting to get back to what was normal, a lot of people I've spoken to are still very wary of going back to the way it was before. And particularly elderly people are thinking that they may actually stay locked down a little bit longer just to be on the safe side. That's fine when they've got the technology to support them and they can keep in touch with their families. Of course, in Cyprus, we have a lot of elderly people who are isolated in villages, probably without the internet. And for them, a continuation of the isolation that they've been facing could be very different. So I've invited gerontologist Marios Kyriazis to join me and explain the issues that are at stake, particularly in this vulnerable group.
We have about 100,000 older people in Cyprus, and many of them live alone anyway. But now with these new measures, a significant amount has to live alone without visits from relatives or neighbors or other people. So this has a negative effect on their life in many aspects, not just the psychological aspect. And the dangers are growing with every week of isolation. Initially, we believed that it would be a few weeks of social isolation, but as the passage of time and with new information coming in from other countries, it was extended to an expected period of 3 to 4 months. Now we are, I personally believe, it's going to be much longer for this particular group of people. So it may be several months or until the end of the year. It's going to cause significant problems in many aspects of these people's lives.
What are the main problems that they face apart from loneliness?
In reality, when somebody is alone in the house, first is the obvious psychological problems. If they hear the news all the time, this creates a lot of anxiety and stress because usually they hear all the negative aspects of the pandemic. Then there is depression, disturbances of sleep. People can't sleep properly, so they have to take tablets to help them sleep. If they take these tablets, many older people wake up at night to go to the toilet and they will be sleepy because of the tablets. So they may fall, break their leg, and end up in hospital. And this increases the risk of dying. So from an initial small point, just waking up to go to the toilet, you may end up in hospital because of medication you may be taking. Then there is the medical aspect. In other words, many people they may have an illness and they are afraid to go to the hospital or afraid to go to the doctor because they are afraid that they may get the coronavirus. And so they stay at home and their problem doesn't get treated properly.
Is there any evidence that elderly people, or indeed anyone, who is under the weather, as we say, is not going to the doctor or not even contacting the doctor because, first of all, they may fear that they're taking up the doctor's valuable time when the pandemic is ongoing, but also because they're afraid they might catch it?
Yes, it's something we hear all the time, both me and my colleagues and other people. People say, and I've seen them in real life, say that I have an unrelated problem and I don't want to go to the hospital because I'm afraid. Or another thing is that the services in hospital now are downgraded. So people who may want to go for a checkup or some less urgent reason, they prefer not to go, or they are made not to go because the service is not there.
Well, so that is changing in the next few days, I think, isn't it? Or it's already started to change, that the hospitals, I think, are starting to make appointments for people, so that will change. But you've still got to overcome the fear, I suppose.
Yes, because people are so afraid and so panicky that it's going to be many months before everything comes back to normal from that aspect. I've heard the other day about a child. It's not about older people. I assume there are cases, but a particular case of a child, 5-year-old child, who was so much bombarded with messages from the television, wash your hands, keep clean, stay at home, that he was washing his hands for 40 minutes constantly under running water because he was afraid to catch the virus. So it's something we are instilling now in people, a fear, which is very difficult to go away. It may take years to go away. And this is going to have the negative effects that come with it.
Right. What can, again, since you're a gerontologist, let's concentrate on the older people and the ones who may well have to, as we said, stay in isolation for longer. Do we still mean sort of total isolation? Or do you think that as things improve, they will be allowed to have visits from family and so on that would just help them along?
I don't think anybody knows about the exact details. But the point is that if they are in isolation, then it has to be proper isolation. Otherwise, they shouldn't be in isolation.
So what can they do while they're in isolation? Because if they are lucky enough to be au fait with technology, they can, of course, keep in touch online with people. Do we have any community services, for example, that do group exercise classes online? You know, that would give them a bit of company and, of course, the all-important exercise that most of them are missing.
We don't have anything centrally organized by the state. It's something that we are trying to do just now. There are many other volunteer organizations that they do it on their own accord. In other words, they present exercises either through videos or any other ways for people to do at home. But it still involves having a computer so that you can see the video. Something we are trying to do with the Ministry of Health is to provide videos with simple exercises to show on public television. So people can watch it for 5 or 10 minutes, do the exercises, even simple exercises like standing up, sitting, moving your legs, stretching, lifting up books or other heavy weight. And this has some benefits. It's not ideal, but it's something.
It's better than nothing. Yeah, but I'm thinking of, for example, again, in the Nordic countries, it's quite common for the practices physiotherapist, for example, not to go to individual houses, but to get 4 or 5 of these people online who need physiotherapy as a group, so they can see each other, they can talk to each other and do their exercises. Are we so far behind we can't organise something like that in Cyprus?
No, we can't, strangely enough. We are able to organise the 8998 telephone service in a few days, which gets hundreds of thousands of calls. And yet we are not able to organize this thing that you just said, because there is no interest. People who can do it are just not interested. We suggested something similar for people to log in and do group exercises. But then they said, oh, I don't know, it's going to take a long time to organize. By the time we organize it, it will be all over. I don't know who to contact. The other person is not interested and so on. And in the end, we ended up not having it.
What's the answer, Marios? I mean, are there other things we should be looking at, especially if this does continue for the elderly, at least into the autumn? Yes, I mean, the summer's going to be hot, horrible. A lot of these people don't have air conditioning. They can't even really go out, can they?
This is an issue with the hot weather. We always have deaths related to the hot weather in Cyprus. When the time comes, we'll issue ourselves advice for people to stay cool, drink water, fluids, and so on. But apart from physical exercises, we need to also recommend brain exercises. In other words, trying to keep your brain active and think positively. And there are different exercises we can recommend, apart from the things that people already do, like crosswords and handicraft and other things that they can do at home. There are ways of stimulating your brain, keeping always active. And we are issuing specific examples of these exercises over the next few days. But if somebody is interested, they can always find how to keep their mind active and enforce isolation at home.
Yeah, they can if they're online. Again, let's talk about some of the people possibly in the more remote villages who probably aren't online, don't know how to use a computer. Have we not harnessed our terrestrial TV channels? An awful lot of these people seem to spend a lot of time just sitting in front of the television. Can't they be brought into the picture so that they can actually spend a reasonable amount of airtime dealing with these sort of things? I'm sure there are ways to make it interesting.
Okay, they show programs with cooking or with psychologists or psychiatrists giving them advice, but it's general advice. It's not specifically directed for people who are elderly and are at home on their own. In my opinion, and from what I've seen up to now, people are not interested in doing it. I contacted several television programs and television stations, and they say, oh, it's difficult, we only have 30-second slots, and it costs money, or we'll see. And in the end, they're just not doing it, and people stay there without having the service. And this is something that many scientific studies show that increases the risk of death, physical and mental inactivity at home.
So it doesn't look like a very happy picture for the coming months for these people who are going to be stuck inside for longer. You said that they really need to stay in isolation, but does that stop family members from at least going to visit, even if they're maintaining their distance and not going into a flat, for example, or a house, but coming to the garden fence and talking? Should people in villages be looking after their neighbours like that?
Yeah, but this is something that should be done anyway, even in normal periods when we don't have any pandemics. Neighbours or people who are interested, or volunteers or relatives, should make an effort to go and interact with somebody who is on their own. People who are on their own, more often than not, have a neighbour who is on their own too. So they should arrange to meet. Individual people who are alone in their houses can meet with their neighbour, or in some other way organize discussions, or, as you said, over the fence, or go out in the street and meet somebody who is also alone. We don't have to involve the relatives or volunteers. People can do it themselves.
Most old people have a telephone, and maybe we need to go back to the older technology, if you like. Are there any groups that have been set up to literally just phone people who are known to be living alone? I'm assuming that information, the authorities have it, so that people could just phone up and have a chat.
That's a very important point, and something we've been trying to do. No, there isn't. Apart from individual volunteers who do it on their own accord, there isn't anything more organized. Because, again, when I raised that with the authorities, they said, we have to be careful of personal information. We don't have the technical facilities to do that. We don't have the facilities to monitor it. We have to think about health and safety. And they find all sorts of excuses not to do it. And in the end, it's not being done unless an individual volunteer does it themselves.
So again, we're talking about people really having a look around their own neighbourhood for who might be vulnerable. I can understand the data protection thing, and if these measures get lifted to some degree and old people are still expected to stay home, they then, of course, I suppose, are very much liable to fall prey to some of the nastier individuals in society who might be scamming from door to door and so on and so forth.
Yeah,
any advice for
as well, yes.
Yeah, any advice for older people who are stuck at home as to how to spot the scammers? Because we are always getting reports from the police at Christmas time, for example, and I guess if old people are known to be stuck inside alone and wanting to talk to somebody, then it's quite easy for other people to come along and take advantage.
Well, the advice I always give is that if somebody rings your bell, the first thing you should think is that it is a scammer. Even if you're waiting for somebody, for a relative to come, or if you think that somebody's safe, the first thought in your brain should be that it is a scammer who is going to come in and steal my money. If you take this approach, then it means that you're generally more careful. Yes, people who are alone, they will say, the bell is ringing, some company, I'll go and talk to them. But if you have in mind that this person who you're talking to just now is here to steal your money or
gain access to your house anyway. I mean, so the first thing surely is that you shouldn't open the door. Hopefully if you're living in an old house, you've got those windows in the door so you can have a look to see who it is.
The people usually don't open the door to have a chat. I think this is wrong. You should just protect yourself, speak to them through a closed door or a window. And if you are suspicious, just ask them to go away and don't open the door.
And call the police, I suppose.
Yes, if you think there is something dangerous, yes. Usually people who come for a legitimate reason, they have their IDs with them or they call beforehand, and so you are expecting them to come. And if you ask them to show their ID, they usually show it if they are legitimate.
Can I ask you finally, Marios, the role of GPs in all of this? Because we've all been told since mid-March that we must not go to the doctor, we should phone the doctor. That's fair enough. How far are GPs going out of their way, since I presume their surgeries are to a large degree empty these days, and actually calling the older people who are on their lists maybe twice a week to see that they're okay? Shouldn't they be doing that?
Maybe some of them are doing it. But this is something that we also wanted to develop more widespread all over Cyprus for GPs who have the records and the details of older people, to call them, even if there is no particular reason, call them, see if they are right, check their medication, see that they don't have any new illnesses. But when we tried to do that, again, we found a lot of difficulties and negativity and problems with identifying such older people. There are some computer programs that automatically identify these older people, but we don't have them in the medical
No, but every GP has the records of who's on his books, and the first thing they will have is age, presumably, and any underlying conditions.
Yeah, but they have to individually go search through 2,000 patients and find each person and call them. This is an extra effort for the doctors, and maybe they are not willing to do that. I haven't heard of anybody doing it, but I assume maybe some goodwill doctors are doing it.
Well, they must surely have a computerised database of their patients and be able to search it on the age of patients or something. It can't be that difficult. I'm surprised that these sort of things haven't been rolled out. Now we had the chance to do it.
Exactly, yes, my thoughts exactly. But I don't think people have thought of that. The people who are advising the government have only thought about the pandemic. They haven't thought about the side effects and the after effects of the social isolation.
And the underlying problems of older people who have other conditions. Yeah. That's very concerning. What would be your advice then to everybody?
First of all, not to hear constantly all the negative news on the television or the radio. Have a positive attitude. Try to exercise at home. Even small amounts is better than nothing. And try to get away from not doing anything at all. And then social communication with other people using whatever means, like telephone or online or computers, or just talking to your neighbors. So social, physical, psychological positive thoughts.
And the National Gerontology Centre in Cyprus, what role does that play in all of this?
Well, it's a new center. We are only a few months old, and we are trying to address these problems specifically for older people and health-related matters of older people. And we have several private volunteer organizations, but we need the support of all aspects of government, all departments of government, in order to give an efficient service. We are a voluntary organization as well. So we are trying as much as we can in association with our partners and supporters.
That is Dr. Marios Kyriazis from the National Gerontology Centre of Cyprus, talking about the problems faced by old people in particular and those with underlying medical conditions which make them especially vulnerable to the COVID-19 virus. Thank you very much indeed for joining us. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.